If you wake up at 2 or 3 in the morning short of breath, or with your heart pounding for no reason, you've probably told yourself it's just age, or too much coffee, or stress. Maybe you drink some water, wait for it to pass, and go back to sleep. But new research suggests these nighttime episodes could be the earliest warning sign of heart failure, and most doctors are dismissing them as anxiety or acid reflux. That means millions of people are getting the wrong answer at the worst possible time. I'm Dr. Spiff Thompson, a cardiologist with over 20 years of experience treating heart disease in adults over 60. I've sat across from hundreds of patients who came to me too late, not because they ignored their bodies, but because someone told them nothing was wrong. Today, I want to change that. Before I break down what this symptom really means, I need you to do one thing right now. Drop a comment below. Do you or someone you love wake up at night with breathlessness, a racing heart, or a sudden feeling of dread? I want to see how common this is before we go any further, and don't forget to subscribe to the channel for more. Picture this. A 65-year-old man, let's call him Gerald, sits in his doctor's office looking tired. He explains that he's been waking up 2 or 3 times a night, shuffling to the bathroom, and struggling to fall back asleep. He's exhausted. His concentration is slipping. He just wants answers. His doctor nods, makes a note, and says something like, "Well, Gerald, at 65, your bladder just isn't what it used to be. Try cutting out fluids after 6 p.m. and see if that helps." Gerald nods back. It sounds reasonable. It sounds like something he's heard before. He leaves the office feeling like the mystery is solved. But here's the problem. Gerald doesn't have a bladder problem. He has a fluid problem. And those are two very different things. During the day, when Gerald is on his feet, excess fluid in his body gets pulled downward by gravity. It settles in his legs and ankles. He might notice his socks leave marks on his skin by evening, or that his shoes feel tighter than they did in the morning. He brushes it off. Most people do. But the moment Gerald lies down at night, that fluid doesn't stay in his legs. It shifts. It moves upward through his body and begins to collect around his lungs. His heart, which is already working harder than it should, suddenly has to deal with more pressure than it can handle. So it signals the brain. The brain wakes him up. He stumbles to the bathroom, not because his bladder is full, but because his body is desperately trying to get rid of fluid it cannot process properly. Cutting out his evening glass of water does nothing to fix that. The fluid was already there, stored in his tissues, waiting for him to lie down. Telling Gerald to drink less is like telling someone with a leaking pipe to just put a bucket underneath it. It manages the surface. It ignores the source. This is the dismissal moment that plays out in doctors' offices every single day. And it's not because doctors are careless. Most are doing exactly what their training told them to do. Nighttime urination is incredibly common in older adults, and a bladder explanation is quick, simple, and usually correct. The problem is that when it isn't correct, when the real cause is a struggling heart, that simple explanation can cost someone months or even years of treatment time. Gerald went home, cut out his evening tea, and felt slightly better for about 2 weeks. Then the waking got worse. 6 months later, he was in the emergency room. His story is not rare, and the terrifying part is that the warning signs were there all along. They just got a perfectly reasonable explanation that turned out to be completely wrong. Here's where the science comes in, and it's hard to ignore. Researchers from the Japanese Circulation Society studied thousands of adults who reported waking up at night to use the bathroom, a condition they called nocturnal polyuria, which simply means producing too much urine during nighttime hours. What they found stopped a lot of people in the medical community cold. People who woke up 2 or more times a night had a significantly higher risk of underlying cardiovascular disease than those who slept through. Not a small difference, a meaningful, measurable one. And the connection wasn't random. The research pointed directly to fluid redistribution, the same nighttime shift we talked about in Gerald's story. When the heart isn't pumping efficiently, fluid builds up in the body during the day, and then moves toward the chest and kidneys at night. The kidneys respond by producing more urine. The bladder fills. The person wakes up. What looks like a bladder issue on the surface is actually the heart sending a distress signal through the only channel the body has available at 2 in the morning. That finding is remarkable. But what's equally remarkable is how slowly it has moved from research journals into everyday medical practice. The gap exists for a straightforward reason. Most doctors are trained to treat the symptoms sitting right in front of them. The patient says they're waking up at night to urinate. The doctor addresses urination. That's not negligence. That's how a busy clinical system works. But it means the trigger behind the symptom, the fluid redistribution, the quietly struggling heart, gets left out of the conversation almost every time. There's also the issue of how questions get asked. The doctor might ask, "Are you having any heart symptoms?" A patient who wakes up needing the bathroom doesn't connect that to their heart, so they say no. The dots never get connected. The chart gets a note about bladder frequency, and the appointment moves on. This research has been available for years, but knowing something in a journal and applying it in a 10-minute appointment are two completely different things. That gap between what the science says and what patients are actually told is exactly why you are watching this video right now. To understand why this happens, you don't need a medical degree. You just need to follow the fluid. During the day, your heart is responsible for pushing blood through your entire body, from your chest all the way down to your feet and back up again. When the heart is healthy, it handles this without much trouble. But when it's weakening even slightly, it struggles to push blood efficiently against the natural pull of gravity. The blood moves more slowly. Fluid begins to leak out of the blood vessels and collect in the soft tissue of your lower legs and ankles. You might see it as mild swelling, or feel it as that heavy, tight sensation in your feet by late afternoon. Doctors call this edema, which simply means fluid trapped in the tissue where it doesn't belong. Now comes the part most people never hear about. The moment you lie down at night, gravity disappears from the equation. That fluid that spent all day sitting in your legs suddenly has a clear path back into your bloodstream. It gets reabsorbed quickly, and your blood volume rises. Your heart, which was already under strain, now has even more fluid to deal with. It can't keep up, so your kidneys step in. Their job is to filter the blood and remove what the body doesn't need, and right now, they're seeing far more fluid than they should. They work overtime to get rid of it. They produce urine. Your bladder fills, and at 2 or 3 in the morning you wake up. Then it happens again an hour later, and sometimes again after that. Think of it like a clogged drain in a busy household. During the day, when only 1 or 2 people are home, the water moves slowly, but it manages. Nobody notices the problem. But in the evening, when everyone is home and all the taps are running at once, the pressure builds and the water starts backing up everywhere. The clog was always there. The house just had to get full enough to reveal it. Your body works the same way. The heart's weakness is present during the day, but nighttime is when the pressure finally builds enough to show you something is wrong. The question is whether you recognize it for what it is. Now let's talk about who needs to pay closest attention to everything we've covered so far. Because while nighttime waking is common in older adults, certain signs point more directly to the heart as the cause. The more of these that apply to you, the more urgently this conversation needs to happen with your doctor. First, take a look at your ankles around 5 p.m. Pull down your socks and press your finger into the skin just above your ankle bone. If your socks have been leaving deep, visible indentations in your skin by the end of the day, that is fluid sitting in your tissue. Not tight socks, not a circulation quirk. That is your body telling you it cannot move fluid the way it should. Second, think about your blood pressure history. If you have been diagnosed with high blood pressure, or if you are currently taking medication to control it, your heart has been working under extra strain, possibly for years. That kind of long-term pressure quietly weakens the heart muscle over time, often without any dramatic warning signs, until the damage is already done. Third, pay attention to how you feel when you lie flat. If you find yourself propping up on 2 or 3 pillows just to breathe comfortably at night, or if lying completely flat makes you feel a tightness or heaviness in your chest, that is not a comfort preference. That is your body responding to fluid shifting toward your lungs the moment gravity stops holding it down. Fourth, if you are currently taking medication for type 2 diabetes, your risk is higher. Diabetes affects the blood vessels and the nerves that help regulate heart function. Many people with diabetes already have early heart changes by the time they are diagnosed, changes that never announce themselves clearly. Fifth, and this one catches people off guard, if you have gained 3 or more pounds in a single day without any obvious reason, that weight is almost certainly fluid. Fat does not accumulate that fast. Muscle does not either. A sudden jump on the scale, especially when paired with any of the other signs on this list, is one of the clearest red flags the body can produce. If 2 or more of these apply to you, keep watching. The next part of this video was made for you. Arthur was 68 years old when he first noticed the pattern, waking up at midnight, then again at 2, sometimes a third time before the sun came up. He was tired all day, struggling to concentrate, and quietly embarrassed by what he assumed was a failing prostate. His brother had dealt with the same thing. His father before that. It felt like a family inheritance he had no choice but to accept. He went to his doctor, who confirmed what Arthur already suspected. Prostate issues were common at his age. A few tests, a few supplements, and a recommendation to follow up in 6 months. Arthur did everything he was told. He bought the supplements. He cut back on fluids at night. He adjusted his routine and learned to live with the exhaustion. For a full year he managed. Not well, but enough to keep going without asking more questions. Then one winter, Arthur developed a cough that wouldn't leave. It wasn't dramatic. No fever, no chest pain, no obvious illness. Just a dry, persistent cough that showed up every time he lay down and eased off when he sat up or moved around. His wife thought it was the dry air. Arthur assumed he had finally picked up a chest cold that was taking its time leaving. But his daughter, who worked as a nurse, heard something different in that cough. She recognized it as the kind that comes with fluid. The kind that sits in the lungs and gets disturbed the moment a person goes horizontal. She pushed him to see a cardiologist, not a urologist, not a GP. A cardiologist. The results came back within a week. Arthur had stage B heart failure. His heart was already weakened, already enlarged, but he had not yet had a major cardiac event. Stage B meant the damage was real, but the window to slow it down, manage it, and protect his quality of life was still open. His cardiologist told him directly, if he had come in 12 months earlier, when the nighttime waking first began, the picture might have looked very different. Arthur didn't have a prostate problem. He never did. He had a heart that had been quietly asking for help for over a year, and a symptom that made everyone look in the wrong direction. Here is something practical you can do right now, or tonight before you go to bed. You do not need any equipment. You do not need a medical background. You just need 2 minutes, and a willingness to pay attention. The first is called the pitting test. Sit down and find your shin bone, the hard bone that runs down the front of your lower leg. Using your thumb, press firmly into the skin directly over that bone, and hold the pressure for a full 5 seconds. Then let go and look closely at the spot where your thumb was. If the skin springs back immediately and looks normal, that is a good sign. But if there is a small dent, a visible indentation that stays behind even after you release the pressure, that is called pitting edema. It means fluid has collected in the tissue of your leg and is sitting there under the skin. That fluid did not come from nowhere. It is there because something in your body is not moving it the way it should. And as we have already covered, when you lie down at night, that fluid does not stay in your legs. It travels. A small dent does not mean you are in immediate danger. But it does mean you have a piece of information that belongs in a conversation with your doctor, not in a drawer somewhere. The second test is even simpler, but most people underestimate it. Weigh yourself every morning, not occasionally. Every morning, at the same time, before you eat or drink anything, after you use the bathroom. Write it down or log it in your phone. What you are watching for is not gradual weight change over weeks. You are watching for sudden jumps. If your weight goes up by 2 or 3 pounds overnight, and you did not eat an unusually large meal or drink heavily the night before, that increase is almost certainly fluid. Your body held onto it while you slept, instead of processing it properly. Neither of these tests gives you a diagnosis. What they give you is evidence. Concrete, specific, dated evidence that you can bring to your next appointment and say, this is what I found, and I need you to take it seriously. That is exactly how Arthur's story could have gone differently, and how yours still can. Knowing what is happening is only useful if you do something with that knowledge. So let's talk about exactly what to do. Not in vague terms, but in specific, practical steps you can start this week. The first thing is to track. For the next 48 hours, keep what doctors call a frequency volume chart. It sounds technical, but it is straightforward. Every time you use the bathroom, write down the time and, if possible, roughly how much urine you produce. You can use a measuring jug from your kitchen. This is something doctors actually recommend. Do this for 2 full days and nights. What you are looking for is the ratio between daytime and nighttime output. A healthy pattern produces most of its urine during the day. If your chart shows the opposite, more trips and more volume at night than during the day, that pattern alone is a meaningful clinical finding. Print it out or show it on your phone at your next appointment. It changes the conversation immediately. The second step costs very little and can begin today. During the day, wear graduated compression stockings, the kind that are tighter at the ankle and gradually looser toward the knee. They work by gently squeezing the fluid out of your leg tissue and back into circulation, while gravity is still working in your favor. This means less fluid gets stored in your legs during the day, which means less fluid is available to shift toward your chest and kidneys when you lie down at night. Pair this with 30 minutes of leg elevation before bed, lying down and propping your legs up above the level of your heart. This helps drain whatever fluid remains before you go to sleep, giving your body a head start before the nighttime redistribution begins. These 2 steps together will not fix an underlying heart problem, but they can reduce how often you wake up at night while you are working toward a proper diagnosis. And that matters for your sleep, your energy, and your ability to think clearly the next day. Now for the most important step of all. When you see your doctor, ask specifically for 2 things by name. The first is an NT-proBNP blood test, a direct measure of the stress your heart is currently under. The second is an echocardiogram, which is an ultrasound of your heart that shows how well it is actually pumping. A normal EKG is not enough. These 2 tests are what tell the real story. Before we move on, we need to talk about the things people try that not only fail to help, but can actually make the situation worse. Because if you have been waking up at night for months, there is a good chance you have already reached for one of these. The most common response is to buy an over-the-counter bladder control supplement. Walk into any pharmacy or scroll through any health website, and you will find dozens of them. Pumpkin seed extract, saw palmetto, magnesium blends, herbal combinations with confident-sounding names. The marketing is convincing. The reviews often sound promising. And for people whose nighttime waking is genuinely caused by bladder issues, some of these may offer mild relief. But if the real cause is fluid redistribution from a struggling heart, these supplements do absolutely nothing to address what is actually happening. They target the bladder. The bladder is not the problem. You are essentially trying to fix a leak in the roof by mopping the floor. The floor gets drier for a moment, but the water keeps coming. The second and more dangerous response is deliberate dehydration. This is where people decide that if fluid is the problem, the answer is to take in as little of it as possible. They stop drinking water after midday. They cut out soups, fruits, anything with moisture. They feel mildly virtuous about it, and sometimes notice slightly fewer trips to the bathroom in the short term. Here is why this is dangerous. Your body needs adequate fluid to keep your blood at the right consistency and volume. When you deliberately dehydrate yourself, your blood becomes thicker and harder to move. Your heart, which is already working harder than it should, now has to push thicker blood through your vessels. Your blood pressure can spike. Your kidneys, which depend on steady fluid flow to function, come under serious strain. You are not solving the problem. You are adding 2 new ones on top of it. If your nighttime symptoms are heart-related, dehydrating yourself does not reduce the fluid that is causing the problem. That fluid is already stored in your tissue. Drinking less water does not release it. It just makes everything else harder. The answer is not less water. The answer is finding out why your body is storing fluid in the first place. Here is something important to hold on to as we near the end of this video. Everything we have discussed today, the fluid shifts, the research, the risk factors, the tests, applies to a specific cause of nighttime waking. But nighttime waking has more than one cause, and getting the right answer depends entirely on understanding which one applies to you. Take two men, both 67, both waking up twice a night to use the bathroom. From the outside, their situation looks identical. But underneath, what is driving their symptoms could not be more different. The first man has a condition called benign prostatic hyperplasia, BPH for short, which simply means his prostate gland has grown larger with age and is pressing on his bladder. This is extremely common in older men. It causes frequent urination, a weak stream, and yes, nighttime waking. For him, the right path involves a urologist, possibly medication to shrink or relax the prostate, and regular monitoring. His heart may be perfectly healthy. The second man has the same nighttime pattern, but his prostate is fine. His waking is driven by fluid, redistributing from his legs to his bloodstream the moment he lies down, overwhelming his kidneys, and filling his bladder repeatedly through the night. For him, a prostate medication does nothing. What he needs is a cardiologist, an NT-proBNP test, and an echocardiogram. Same symptom, completely different causes, completely different solutions. This is why a generic answer, whether it comes from a supplement label, a late-night search, or even a well-meaning friend, cannot protect you. The symptom is a signal. It is your body saying that something needs attention. But the signal alone does not tell you where to look. That requires context, your full medical history, your other symptoms, your medications, your lifestyle, and yes, the right tests. What this video has given you is a framework, a way of asking better questions and knowing which ones matter. It has given you the names of specific tests to request, and the language to use when you ask for them. But the conversation that determines your next step happens between you and your doctor, not in a comment section, not on a health forum. Use what you have learned here to walk into that appointment better prepared than you have ever been before. We have covered a lot of ground today, so let's bring it all together into steps you can actually use starting tonight. First, check your ankles around 5 p.m. Press your thumb into the skin over your shin bone for 5 seconds and see if a dent stays behind. Second, keep a simple log for the next 48 hours, every nighttime bathroom trip, what time it happened, and roughly how much you produced. Third, step on the scale every morning at the same time and write the number down. And fourth, book an appointment with your doctor and ask specifically for an NT-proBNP blood test and an echocardiogram, not just a general checkup. Those two tests, by name. If 2 or more items from the risk checklist apply to you, do not put this off. Do not wait for a more dramatic symptom to appear. The whole point of everything Arthur went through, and everything this research is telling us, is that the dramatic symptom is what happens when you wait too long. Your body talks to you at night. It uses the language it has available: a full bladder, a racing heart, a breathlessness that wakes you from a deep sleep. Most people roll over, wait for it to pass, and tell themselves it is nothing. Now you know it might be something. And knowing that is the difference between catching a problem early and dealing with the consequences of catching it late. If this video helped you see your body differently, if it gave you a question worth asking or a test worth requesting, please hit the subscribe button. Every week I bring you research-backed information that your appointments may not have time to cover, broken down in plain language you can actually use. Next week, I am revealing the 3 foods that most people over 60 consider healthy, but that are quietly raising blood pressure during the night, when nobody is checking, and the damage adds up fastest. You will not want to miss that one. And before you go, this video is for educational purposes only. It does not replace the advice of your personal doctor or any qualified medical professional. Always consult your physician before making changes to your health routine or interpreting any symptoms you are experiencing. Thank you for watching. Now go check those ankles.